Can you refuse medical treatment without informed consent? Imagine being told you need a medical procedure, but you feel unsure or uncomfortable. Do you have the right to say no? Well, that's what practicing informed consent is all about. It's a key part of respecting a person's autonomy, which means their ability to make decisions about their own body and health. Informed consent isn't just about signing a form. It's a process where healthcare providers share clear details about the treatment, including the risks, benefits, and available options. The goal is for patients to understand what might happen if they go ahead or refuse treatment. If they decide to refuse, they need to know what that could mean for their health and future. Now, if a patient has decision-making capacity, that is, they understand the information, appreciate the consequences, reason through the options, and can communicate their choice, their refusal must be respected. Even if the doctor thinks the treatment is best or the outcome could be worse without it, the patient's right to refuse remains. This is a core principle in medical ethics and law because it recognizes each person's dignity and freedom. But what if someone refuses treatment without fully understanding the implications? Sometimes patients might decline because they're scared, confused, or not given enough information. In these cases, healthcare providers have a duty to ensure the patient truly understands what they're refusing. They should explain the risks and answer questions. If after this, the patient still refuses, their decision should be honored, provided they have the capacity to make that choice. There are exceptions, though. In emergencies where a patient's life or limb is at immediate risk, and they cannot communicate or lack decision-making ability, doctors can give treatment without consent. For example, if someone is unconscious or mentally incapacitated, a legally authorized representative may give permission. But for adults who are capable, overriding their refusal is generally not allowed. Respecting a patient's right to refuse treatment is about honoring their moral and legal independence. It's also about making sure they are fully informed and their choices are documented. Clear communication and proper documentation protect both the patient and the healthcare team. Sometimes, healthcare providers might feel that refusing treatment is unwise or could cause harm. They might want to act in the patient's best interest. But the principles of beneficence and non-maleficence, doing good and avoiding harm, do not override a capable patient's right to refuse. Justice also plays a role, ensuring everyone has equal opportunity to accept or decline care based on their values. In the end, adults with decision-making capacity can refuse medical treatment. Their refusal must be informed, meaning they understand what could happen if they say no. Respecting this right is fundamental to treating people as autonomous individuals. Healthcare providers must communicate well, ensure understanding, and respect the patient's choices, while also knowing when exceptions apply to protect life and health.